of a local teenager who is part of a revolutionary way neurosurgeons are treating patients. And as you'll see in this report, Delray Medical Center is one of the first hospitals in the country to perform this innovative surgery.
Today is June 26th.
Great.
Chris Johnson will spend a lot of his summer here in the office of his speech therapist.
I'm going to give you an equation.
This is where the 16-year-old is relearning his language skills after suffering a traumatic brain injury in January.
Chris was with a bunch of friends. They were at a miniature golf course, and he wound up getting hit in the head with a golf ball.
Chris's parents rushed him to the emergency room when they realized it was more serious than they first thought.
He was slurring his words, limited speech. It's tough when it's your child.
Chris had a brain hemorrhage and needed surgery. That's when Dr. Lloyd Zucker was called.
This is for the patient for tomorrow?
He's the chief of neurosurgery at Delray Medical Center. Zucker told the Johnson family about a revolutionary approach to brain surgery that only 100 doctors in the U.S. have been trained to do.
It's called BrainPath. It's named that because it is actually giving us a corridor or a path by which we can approach something that is within the brain. That something can be a hemorrhage, it can be a tumor.
These are all the fibers.
Those are all the fibers within the brain.
Zucker says this new approach allows doctors to see, access, and remove brain abnormalities through an opening as small as a dime.
I can actually get a feeling for where I should go and where I shouldn't go, plan that in advance, and then once I enter the operating room, I actually navigate along that pre-planned path. There is no guesswork anymore.
Here's how it works. With state-of-the-art imaging, doctors can see with clarity the brain's fiber tracks, allowing them to plan and navigate a pathway before they start surgery. Then, with this innovative technology, they can safely move through the natural and delicate folds of the brain without causing any more damage. With help from a high-definition camera, surgeons can then remove the abnormality.
What we're trying to do is to go along that path of least resistance and not create any more damage than the process that we're trying to get to has created in the first place.
Chris was Zucker's first patient to undergo the procedure. Before the surgery, Chris could only say about 2 words.
In the beginning, I couldn't even talk pretty much. And so after about 4 months, I kind of feel normal.
He is doing so well, Chris is hopeful by this fall, he'll be back to his old life.
Just to go back to school and still get A's and play lacrosse and play sports and just,
Get back to doing what you're used to doing.
Yeah, definitely.
And I know he'll do it. This new procedure is so effective. Chris was out of the hospital and in a rehab facility within 36 hours of having it done. Such a great kid, and he's working really hard.
Wonderful to see him talk. He
Yeah.
looks great. And 36 hours, that's just an amazingly fast recovery time.
Yeah, that's part of the benefits of this surgery. I mean, imagine the traditional way to do brain surgery. It's to cut a major portion of the skull, but with this small opening, they can get in and out without doing a lot of damage, so the patient recovers that much faster. Was so impressed to meet him, and he's just doing great. Really happy for the family.
It was a great story.